when someone comes to see us, by the time they come to see us, they probably have had hoarseness for more than a few weeks to a month or more. And the common causes are generally due to vocal abuse or misuse of the voice. We all know how to talk, but most of us don't know how to talk efficiently. It's like running. We all know how to run, but most of us don't run efficiently. We're not trained to run. Someone who's been coached to run the marathon will do a lot better than someone who's just going to run the marathon. So if you're someone you're using your voice regularly, like for example a news presenter, a journalist who's speaking on the phone, a singer or a teacher, these are the common people who tend to have voice problems. And a study done many years ago in my teaching hospital in Tan Tock Seng Hospital showed that the biggest number of group of patients who come to see us for voice problems would be teachers. Yeah, so it's an occupational hazard, and the problem is if you overuse your voice. What is the voice? The voice is actually filled with muscles, and overlying that muscle is skin. So you can have, just like you're overusing your muscles when you run, you overuse your muscles when you talk, you're going to have problems. So we have to ascertain what the problem is. If the person may come and see us for a common problem like what we call vocal cord nodules, but we have to know where the problem is, and if it is due to just vocal abuse, then offering them surgery may not be the right answer, because if the person doesn't change the way he or she speaks, once you remove the nodules, the problem's going to come back again because it's not changed the way he or she speaks. So you got to change. You got to undo all the bad habits and give them the good habits. So they need to go for therapy, speech therapy. So the various options for people with voice problems are, after we ascertain what the problem is by looking into the voice box, into the larynx, and then we can decide, okay, this is a surgical issue or this is a non-surgical issue. It may be a surgical issue, but we want to give the patient the benefit of the doubt and go for some speech therapy first, which may help in the post-op care. And a lot of times after the surgery, patients still go for speech therapy too. It's like going for a limb surgery, and after the surgery you go for physio, before and after. It's the same thing. That's what speech therapy is all about. It's basically physio for the voice, and that's what it is. So the options that we have here for the voice are, depending on what the problem is speech therapy, medication, and surgery.